Prevention, CDC, approved the use of Pfizer and BioNTech's COVID-19 vaccine for adolescents aged 12 to 15. Pfizer's vaccine is being used in multiple countries for teens as young as 16, and Canada recently became the first to expand use to 12 years and up. Outside of the US, AstraZeneca is studying its vaccine among 6 to 17-year-olds in Britain. So why then, if the science points to the potential infections and carrying of COVID by children and young people, did our Prime Minister this week say from Monday in schools in England, secondary school kids no longer need to wear masks? And as parents now know the full picture of facts that kids can spread and contract COVID, at least 296 have died in the US, and we all heard the heartbreaking story of 5-year-old Marley Hanley struck down by a rare COVID complication. Should parents write a letter tomorrow stating, my kids need to wear their masks and keep them on? Well, joining me now to discuss this as a parent and our resident doctor is psychiatrist Dr. Shazli Budlaya. Good afternoon, how are you?
I'm fantastic, Trevor. It's been a long while and a well-researched opening statement as always, and to the point. I would like to give a balanced view on that, but on two things. One is I've had my COVID-19 AstraZeneca vaccine 2 weeks ago, reluctantly, because I was also concerned about the side effects. And we had discussions before about the BAME communities and how reluctant we were to take the vaccine. But everything pointed that I needed to take it. I have taken it. I've survived so far. So, do go and try and find out more about the vaccine if you're still in the bracket that needs to have the vaccine, and keep yourself protected. The second thing is, obviously I'm a parent, and as I said, I would like to be a balanced discussion about whether children should wear masks or not. Before coming live, I did ask my eldest daughter Shreya, she's 14, and I said, Shreya, what do you think about not wearing masks from Monday? And she said, Mom, no way. And so she's 14. I've got an 11-year-old, Satara, and Aryan, 13, and all are in the age group where the statement, obviously, and this decision from Downing Street, from Boris Johnson and his team, affect everyone and them. So they are reluctant not to wear masks.
And what did she say? What did she say when she said no way? When you said why?
She said, no, Mom, there's still a risk of contracting COVID. And she's done a lot of research. She's done these beautiful articles and drawings of COVID and research onto it for school. And she said, no, Mom, it's too risky. And also because they know that whenever they've gone out, they've always been wearing a mask. And even at school, they know that there's a high chance that they can contract it. And I think recently what is worrying them is, there's a different variants at the moment, even though UK figures have come down drastically in the last 24 hours, according to the Worldometer. And today's figures, obviously the show will be tomorrow, but there's 70 new deaths. We've had 0 deaths in one of the days. And we've had 2,193 new cases, and that's the UK. So even though the numbers have significantly reduced since for a few months now, there is still the chance that they can contract COVID. And Milton Keynes, Buckinghamshire, Northamptonshire, London, up north, Bolton, and a few other areas. Bedford, yes, Bradford, all have the new variant of the India variant, which I think there's quite a large figure, 1,313 as of yesterday. So, we've got the Kent variant, the B117. We've got the South African variant, where I'm from, so 1351. We've got the Japan variant, the P1, the Bristol variant, which is B117, and then the India variant, which is really a concern as we watch as India's had up to 400,000 cases a day and thousands dying, which is so sad to see, especially for me as well, having ancestors coming from that country, and the India variant B16172. And this is what the government is warning. The teaching unions, the teachers are concerned. They are all wanting to write to Boris Johnson and say that this decision will affect everyone. So it's not just going to...
I was looking at this. I saw something on Al Jazeera, and I'm glad you brought up the teachers, where one of the teachers was saying, you look at last year where a government was saying, particularly for our 14, 16, 17, our or less like young adults.
Yeah.
So therefore, can be carriers, can infect. That's why there was a lockdown of going, because these kids were coming from school, going back into the home, and the potential there of super spreaders. And now they're saying they don't need to wear a mask. It contradicts everything. It doesn't make sense to people.
It doesn't. And I think on the one hand, I understand
for their own health as well.
No, I totally agree. On the one hand, we do want things to go back to normality. So, as of today, the stage 3 of the roadmap, pubs and restaurants are opening. Group of 6 can
Tomorrow,
meet. Yeah, we can hug people, we can hug friends and family, and also, obviously, school kids don't have to wear masks, which is now the concern. We know that funerals, you can have up to 30, weddings up to 30, and sports gatherings of up to 3,000. So obviously, we know that we want things to get back to normal. Cinemas are opening, indoor play areas are opening, and other hotels and holidays are resuming. But at the end of the day, we need to do it safely. And at the moment, if there's a possibility of a third wave, of the kids being super spreaders and now putting in this decision, it's going to impact not on the teachers and their health and well-being, on children's health and well-being. Coming to America, which you raised, very rightly, about the vaccine. So the Center for Disease Control, CDC, is saying that children should be vaccinated, especially like the bracket 12 to 15, as you've said. So Pfizer vaccine obviously is the one that's being used. AstraZeneca still obviously needs research, and I would be concerned, to be honest, with my 3 kids. I don't know if there's enough information for them to receive the vaccine, but that's my personal opinion, to receive the AstraZeneca. But I've received the AstraZeneca. My husband's received it. We hopefully will get the second dose, and we hopefully will still survive it. But with the new variants on the horizon, with a large bracket of people that have not been vaccinated. I mean, in the UK, we've had 35 million people vaccinated. There is still a large BAME community, I can imagine, that have not. I don't know about you. And
absolutely, I've had the vaccine.
Fantastic, well done.
Dose. But I still have friends who are refusing to take it for all the reasons that you said, and of course all the reasons we spoke about, historical and the mistrust and everything. But but what they're saying is, and this is, I can understand why the hesitancy of getting any kids vaccinated, is because we truly don't know how we will react. Some people in terms of blood clotting, some people in terms of their heart and having palpitation. You don't know. We've taken the risk, me and you have, but a lot of people said they're not willing to do that, and we're certainly not willing for their kids to take it.
Yeah, I think research needs to be done. But if we look at the vaccine, we've all had vaccines when we're young, so those have helped us. We've gone through all these different pandemics and epidemics in the world, and they've done a lot of work with the COVID vaccine. I would urge BAME community to get more information and to consider the vaccine, especially now that we've got that. Especially now that the reason why I'm saying that is because we've got a Indian variant, South African variant, UK variant, Japan variant, all these variants that are spreading faster, causing more infections and more deaths. So people are dying more, and it's transmitting so quickly, so fast, that we can't even manage it, as you've seen in India, which is so sad to see. I mean, we've been so disheartened. And my concern, sorry, Trevor, just to say, if children are going to be the super spreaders and their masks are going to be taken off, there's a chance that my concern is for this bracket, this percentage of people that have not been vaccinated. Irrespective of whether the vaccine is going to help us against all chance. I mean, with the elderly that have taken both the Pfizer, it's reduced the risk by 93%. And even just taking the AstraZeneca and the COVID, the both doses have also reduced the risk. So it's about weighing the risks and benefits, having the vaccine, not having the vaccine, and then also contracting COVID and the risk of death.
Okay, so then let me ask you this. If research from the AstraZeneca comes back, and they're doing research to 6 to 17-year-olds at the moment, if it comes back and says, actually, it's safe to give to children, knowing what you know now and the fact that you have taken the AstraZeneca for yourself, if it comes back and said it's safe, would you allow your son and daughter then to take it?
Yes, so I will discuss it with my husband, and because we're both parental consent, and then discuss it with the children. And if everyone is in agreement, yes, we would urge him to take it. And our children obviously will have guidance, take guidance from us. And also because they know they've had vaccinations in the past, which has helped, we would be asking them to take the vaccine.
Okay, so here's the next question. I started in my introduction by saying, should parents be writing a letter to schools tomorrow insisting that their son or daughter continues to wear the mask? Your daughter and son have said absolutely they're continuing, because if all of the evidence so far pointed to the fact they needed to, what has changed basically overnight? And that's me adding to what they're saying. But to parents listening to our conversation now, and the thrust of our conversation really is about protecting your child and protecting the community. Do you think they should be writing that letter tomorrow then?
Yes, totally, 100%. I would be behind them because, especially as I said, I'm a parent and a doctor and psychiatrist. So having medical knowledge, having the knowledge, and also being a parent, my view and opinion would be that we would have to urge Boris Johnson to review this decision. I understand, as I said, we want to resume normality, but at the end of the day, we need to weigh the risk and benefit. And also, we know that the variants already, the Indian variants, in the Milton Keynes alone, there's a school, the Milton Keynes Secondary School. They detected some cases, and the school had to get tested. So the variant is all over. As I said, London, Kent, Bolton, Manchester, Bedford, Bradford, it's spreading fast. Leicester. So it's spreading really fast.
My hometown. So do you think we will get to stage 4, June the 21st, or do you think actually the way the tide is moving, we're heading for that third wave and potentially another or regional lockdown?
I would like to be more optimistic, and the government has last wave where we lost thousands of people, and then we went quickly into lockdown in November, December, and obviously we came out of lockdown earlier on this year. But having said that, I feel that this is a very critical period. So it could be a period, as you've said now, that it could be that if we don't manage the risk carefully, and the government knows it, and that's why they are treading very carefully. They are being cautious because they know that whatever decision they make now, and also because our PM Boris Johnson had COVID-19 and ended up in ICU, so he knows exactly what we're dealing with. Wave, but I do feel we might get to June 21st. We might get to the next lockdown, the next phase 4, and that hopefully we will be able to prevent a third wave, because a lot of people are already Matt Hancock is talking about it, Prof. Whitty, Boris Johnson, the Sage, the team as well. So all of the teams are working together. And I don't think, and the vaccination has rolled out extremely well, I must say, in the UK. So, but we need more people to get vaccinated.
Brilliant. Dr. Chesney, as always, you're a light of information and knowledge. I hope parents listen. Of course, they'll make their own decision. But thank you for coming on the show today. Thank you so much.
Thank you, Trevor. It's been fantastic to be on. And just to say, obviously, if parents feel they want to send their child with a mask, there's always that thing that's open. If their child wants to wear a mask, and if they are high risk, if they're going back home and they're high risk parents and family and extended family, then they need to wear a mask. So I think at the end of the decision, we each need to make the best decision for not only ourselves, but our loved ones and our families and community at large. Thank you, Trevor. Always a pleasure. Stay safe, and let's spread the love and not the virus.
Brilliant. I love that, because I can edit that up, and that's a nice segue for me to then come out. Actually, that's fantastic as always.
Okay, thank you. Was that okay? Yeah, no, I'm glad I spoke to. Yeah, I'm glad I spoke to my kids, because